Hey guys, this is Katie Kessler. I'm going to be talking about substance abuse during pregnancy for this special populations assignment. The reason I decided to do this um, population is because in both the 12-step meetings I went to, I saw pregnant women attending as alcoholics and as addicts. I went to AA and NA, and I was really overcome with pride for them for coming in here and or coming to the meetings and getting help. But then I thought about all the other women out there who might be pregnant and are afraid to get help or, you know, don't really know what to do, don't have any support. So I wanted to do a little bit more research about this population and let you guys know about it. So today I'm going to discuss the population as a whole, the risk to substance use, or the risk of substance use to the mother, to the baby, and to the pregnancy, common treatments, how the courts handle these issues in Georgia, and what resources are available to those seeking help in our area. So, so the population, starting with that, of the 4 million women who become pregnant each year, at least 20% smoke cigarettes, 19% drink alcohol, 20% use legal drugs, so anything over the counter or what's prescribed to them, and 10% use illicit drugs during their pregnancy. The average percent women will take, I'm sorry, the average pregnant woman will take 4 to 5 drugs during her pregnancy, with 82% of pregnant women taking prescribed substances and 65% using non-prescription substances, including illicit drugs. Substance abuse during pregnancy is difficult to detect because the signs and symptoms of this behavior are often subtle. Self-reports of substance abuse can be misleading or infrequently elicited, and physicians may fail to routinely screen for this use. Also, many women who are pregnant and are substance users may seek little or no prenatal care. Pregnant women with substance use problems are more likely than non-pregnant women to seek assistance from healthcare providers and are more motivated for treatment. So a lot of them see this as, I need to be healthy for my baby, I need to get clean. Pregnant women with substance use problems, no, I just said that. Okay. Indicators suggesting substance abuse during pregnancy include self-reported use, avoidance of prenatal care, premature labor and delivery, placental abruption, and fetal death. Advanced stage substance abusers commonly live chaotic lifestyles, which are characterized by frequent changes in residence or employment, long-standing substance abuse, and some domestic violence. When contemplating the diagnosis of substance abuse, other conditions should also be considered, including depression, personality disorders, PTSD. Symptoms of anxiety and depression may be side effects of substance abuse, so the diagnosis of a psychiatric illness is difficult to make until the patient is sober for several weeks. Also, the more barriers the patient has to treatment, the less likely they are to remain sober. So, common barriers to treatment include a partner who is also using alcohol or drugs, or if they live with someone who's also using alcohol or drugs, a chaotic lifestyle, poor social support system, and a lack of safe and affordable child care services. So if they don't have anyone to watch watch their other kids while they're getting treatment, things like that. I'm going to go on now and talk about the risks. Some risks to the mother include respiratory problems, cardiovascular problems like hypertension and endocarditis, neurological problems like seizures, different things like STIs, renal and gastrointestinal problems, and then also malnutrition and vitamin deficiencies. A big part of being pregnant is changing how you eat and taking different vitamins, because now the baby's sucking out all of your nutrients and things, and so you really need to replenish daily. So if the mother isn't using prenatal care, this can show with like hair loss, different rashes, things like that, of vitamin deficiencies. So some risks to the baby. They can have neonatal medical complications and neurobehavioral changes. Some specific complications are of maternal substance abuse includes sudden infant death syndrome, or SIDS, as we often hear about, neonatal abstinence syndrome, and respiratory distress syndrome. Risk to the pregnancy as a whole, this can be seen as placenta previa, premature rupture of the membrane, which the rupture of the membrane is usually what happens right before you go into labor. It can be anywhere from 24 hours before to a couple days before. But if that happens too early, then that can be really dangerous for the mother and the baby. Spontaneous abortion, premature delivery, birth defects, and long-term developmental effects. So I'm going to go on and talk about treatment now, and I'm just going to focus on treatment if they're using alcohol and treatment if they're using narcotics, because I went to AA and NA, and I wanted to focus more specifically on those types. So whenever you're treating with alcohol use, obviously they just want them to stop using alcohol kind of quick cold turkey, which can obviously cause withdrawal symptoms, and there are 2 different drugs that can be given to pregnant women who are experiencing withdrawal symptoms from alcohol. They are both really long, and I cannot pronounce them, so I won't embarrass myself. It also recommends on this website to get support from programs such as AA. So, and then for Narcotics Anonymous, or for narcotics being used, again, you can go to Narcotics Anonymous, but also methadone is approved for pregnant women, so even nursing women. So they can use methadone throughout their pregnancy and also after their pregnancy, even if they want to breastfeed. So that's important in letting people know that there is help out there. As far as the courts and the laws go, when a parent struggles with drug addiction, his or her parental rights can be affected, and in some cases, CPS can take the child from the parent's care if the parent is abusing drugs. National Advocates for Pregnant Women highlighted 413 cases of pregnant women being incarcerated for forced into drug treatment in the U.S. between 1973 and 2005. However, the U.S. Supreme Court ruled in 2001 that being drug tested without their knowledge or without consent is unconstitutional, but it's only when it could lead to criminal charges. So you cannot charge them pretty much with criminal charges if you find that they're using drugs and they haven't consented to this test. Policies that punish women for substance abuse during pregnancy are contrary to the welfare of the mother and the fetus. This is what the American College of Obstetricians and Gynecologists is trying to push people to consider, is that if you're threatening, being arrested, being incarcerated for your drug use, then why are you going to go to the doctor? Why are you going to get prenatal care whenever they're going to test your urine and you're going to be locked up? So so the ACOG is really pushing for people to remember that and to just be more willing to help these women for the sake of their babies. As of right now, a mother cannot be charged with child abuse in Georgia for using drugs and alcohol while pregnant. However, the baby can be turned over to the state after the baby is born if the baby or the mother has the drug in their system, and then they will open a case and do a complete investigation to determine what else to do. So here are the resources near us, or in Atlanta. The first one listed is in Jefferson, which is actually where I'm from, so I was proud to know there's one close by. And then as you see, there's a few in Atlanta, Marietta, and even one right here on Chamblee-Tucker. So yeah, if you guys have any questions about where I found any of this information, I'll be glad to send you my my links, and thank you very much for listening.